You have a pet that's gaining weight, has skin disease, maybe they're slowing down, they're a little bit sluggish, and you've been to the vet and they're like, your pet is fine. There's nothing wrong with them, but you're looking at them and there's something going on and you just can't quite figure it out, but you know there's something off with your pet. I'm Dr. Katie Woodley, the natural pet doctor, and this is our weekly discussion on different pet health topics with a natural medicine perspective, alongside the conventional, of course, because with this disease, this is really, really important. So what we're talking about today is thyroid disease, and this is actually one of the most common endocrine disorders amongst dogs and cats. So it's number one in dogs, and it's actually number two in cats. So cats' number one endocrine disease is diabetes, and then we have thyroid issues. So let's start with what exactly are thyroid problems. And so because this is so common, what exactly is the thyroid? And some of you may actually have thyroid concerns yourself, and we're going to touch on some of the similarities between dogs and people because we can have similar autoimmune-like diseases too. Where does the thyroid gland sit? So it's actually located in the front of the neck on either side of the trachea, and it produces hormones that are going to affect a lot of functions in the body. So what it does is it takes iodine supplied from the food and it uses it to produce hormones. So thyroxine or T4 is the same thing. We call those are the same. And T3. And then there's also, it's part of the hypothalamic pituitary gland axis. So the pituitary gland in the brain secretes a hormone called TSH, or the thyroid stimulating hormone, that tells that thyroid to secrete those thyroid hormones, thyroxine. And so this is what we measure in the blood as T3 and T4. So keep those things in mind as we talk about this, because it's really important and it's going to affect the testing that we do, and it can also affect the treatments that we do for our pets. So these are really, really important things, and where a lot of people don't realize that we are missing the ball on some of the testing that we are commonly doing in our pets. So what are the differences between dogs and cats? Because there's a very big difference with dogs and cats and thyroid disease. Hyperthyroidism is more common in cats. It's not as common in dogs. Usually for finding hyperthyroidism in dogs, it's due to a cancer of the thyroid gland. There's something off, or there could be a food issue that's supplying too much thyroid gland in that food, and that's elevating those levels and creating hyperthyroidism. And then in dogs, the most common thyroid condition we see in dogs is hypothyroidism. So the thyroid gland is not producing enough of that thyroid hormone. So what are some of the symptoms you might see if your dog is hypothyroid, so too low, or your cat is hyperthyroid? For dogs, we're going to see things like weight changes typically. So you have an easy keeper, your dog, you like drop the amount of food you're feeding and they're still just not losing weight. And you're like, what is going on? It could be a thyroid issue. Skin conditions. Do you have a dog that has chronic ear infections? Have you tested for the thyroid? That can be the underlying problem that's not allowing your pet to heal. Depression, they have lethargy, they're really down and out, they don't have all that energy, they're slowing down on their walks. And then they might have hair loss on their trunk, on their tail. Keep in mind, these symptoms are really vague, right? And they can come along with a lot of other diseases, but this is why it's so important to make sure we're testing appropriately to rule out a thyroid problem, because it is number one in dogs. Cats, what does your hyperthyroid cat look like? So this is where they're producing too much thyroid hormone, and we're seeing hyperactive cats, like crazy cats. They're up all night. They might be meowing and yowling all night. And if you have a cat that does that and that's their normal and you've tested them and you've done the right tests, then I wouldn't worry too much. That might be their crazy personality. But these are things you want to watch for. If you have a cat that has weight loss, they're super hungry and they're just eating everything and they're losing weight, hair coat issues, they look unkept, they look ill thrifty, they just don't have that glow to their coat. And then GI issues, vomiting, diarrhea, these all can be attributed to hyperthyroidism in your cat. So I want you to be looking at those. And the thing is that we can test for thyroid issues. And this is where it's really, really important to make sure that we're doing those tests. And with dogs, we're going to talk a bit about dogs. And one of the most common problems that can happen with the thyroid gland is an autoimmune condition called lymphocytic thyroiditis. It is very similar to the Hashimoto's that a lot of people get. So with low thyroid, a lot of people also have this autoimmune condition that behaves very similarly between people and dogs. Sometimes dogs get older and that thyroid gland kind of peters out, but we have to keep in mind, why are these things happening? And we have to go back to, there could be relations to environmental toxins. What food are they eating? Are they on a poor diet? Are they being over vaccinated? And it's probably a combination of these factors, right? Normally, the body does not decide that it wants to kill itself and goes into an autoimmune condition. There are factors that are going to stimulate an autoimmune condition to happen. That's really important. And it can be really hard to figure out what the cause is, right? There's so many different factors. And if you've been following the Natural Pet Doctor, you've heard me talk about environmental toxins, things that can be in the food. There's a lot of different things and they all add up. But also with dogs, with this autoimmune disorder, this lymphocytic thyroiditis, there's a lot of breeds that can have a genetic predisposition to this disease. So breeds that are commonly infected, of course, are Goldens, Dobermans, Greyhounds, Irish Setters, Dachshunds, and Cocker Spaniels are some of the well-known breeds that are predisposed to having a thyroid issue. And yes, Fucci, I see a question. And can hypothyroidism cause aggressive behavior? Yes, 100%. So if you have a dog who has been calm and quiet their whole life, and all of a sudden they're now trying to bite the kids, they're turning aggressive, they're acting really, really different, you need to get their thyroid tested. And we're going to talk about the different tests that you need to ensure that you are checking specifically if you have a dog, because this can be a subtle thing and it can also be a game changer. And a lot of people end up euthanizing their pets because of this aggressive behavior change. And it's because their thyroid is off. Usually it's too low. So if you are suddenly seeing aggressive behavior, make sure you are ruling out hyperthyroidism with blood work, not just doing a trial treatment of thyroxine. In cats, what we see, the hyperthyroidism. So the thyroid gland is producing too much thyroid hormone. And this is usually a result of benign changes. So hyperplastic changes or non-cancerous changes, or what we call just enlargement of that gland. And it seems actually like it's more common in cats fed specific foods with artificial preservatives, that fish containing foods can be a possibility for these cats developing hyperthyroidism, and of course, over vaccination. And a really neat study that was done over 20 years ago in the UK, and there hasn't been a whole lot of research recently, is that we may actually have a retrovirus issue with hyperthyroidism developing in cats. And we know cats can carry retroviruses. So things like, is the vaccine for feline leukemia predisposing these cats to hyperthyroidism? Now, if your cat is at a high risk of developing leukemia, I am not saying to not get that vaccine, but we need to look at the factors that can play a part in these pets developing these diseases to make sure that we are diagnosing thyroid disease. And so when we're doing, the other thing with cats that's really, really important is that hyperthyroidism can mask kidney disease in older cats. And a lot of times these diseases come together. With hyperthyroidism, it can cause increased blood pressure It can also cause secondary heart issues where that heart wall is thicker because it's working a lot harder. They have a higher metabolic rate. And so they can be predisposed to heart disease, which can lead to sudden death, blood clotting. There's a lot of problems. This is why it's really important to treat your hyperthyroid cat. And yes, there is a time and a place for natural remedies, but we can integrate them in together with the conventional treatment. So if you have a cat that has the GI symptoms, you need to make sure you're also monitoring the kidney function and supporting kidney function with supplements like essential fatty acids, a high quality diet, antioxidants like CoQ10. Those are really, really important. And of course, whenever we're talking about diseases, everything's connected, right? It's not just the thyroid over here by itself, just hanging out, or the kidneys over here by itself. Everything's interconnected. And so when we're feeding appropriate diets, when we're giving the right supplements to optimize overall health, they're all going to play a part for helping the immune system and helping the body, even if we have to give drugs, right? So that's really, really important. So let's talk a little bit about the testing that you need to do to rule out a thyroid issue. So say you are having a dog that has a behavior change, or you have a cat that's acting crazy and losing weight and maybe vomiting and showing these symptoms, or you have a dog that has chronic ear infections and you're like, why is it not going away? I've changed their diet. We've got them on like a really good biologically appropriate diet. And if you guys want to learn more about diets, make sure you register for this month's webinar where we're talking about fresh foods, raw foods, and kibble diets, and how you can assess those diets and the studies behind them so that you can figure out what you should be feeding to your dogs and your cats to optimize health. Definitely check that one out. It's going to be 2 hours long. It's going to be amazing. So if you're doing all those things and your pet is not getting better, you need to get them checked out. Get a full blood panel done, rule out other underlying conditions that could be going on that can be causing those symptoms. Get that physical exam, make sure they're not in pain. So that could be why there's a behavior change or they're slowing down. So those are all really important. But the thing that I find a lot of vets are doing, and years ago found my own self doing, is just checking a total T4. So that T4 is on a lot of comprehensive blood panels. And so when we're like, oh, we're doing a full blood panel, which is fantastic, doing that at least once a year. And then we're like, we're going to check the thyroid too. And that T4 is there. And then you get the blood test results back and you see the thyroid is low. And you're like, oh, your dog has thyroid disease. Well, actually, it might not. There's a lot of different reasons why that thyroid could be low. One of the common conditions that we give a name to with a low thyroid is called euthyroid. And what that means is that the thyroid gland is actually functioning normal, but there's some other disease process going on in the body that is dropping that T4 level. And so if we start supplementing with thyroxine, that T4, we can actually create more of an autoimmune or increase the likelihood that an autoimmune problem is going to happen and cause more degeneration to the thyroid and cause other issues and even make that dog go into hyperthyroidism. So other things too to be aware of. And this is the thing, this is the downside with blood work. Blood work is essential, but we have to keep in mind as pet parents, as veterinarians, that there are ranges. And we have a specific range on that blood work that the lab is looking at. And your dog's going to fall, your cat's going to fall somewhere in that range. But each pet is different. The age can make it different. The breed can make it different. The size of your pet can make it different. Your dog being a dog, your cat being a cat can make it different. So if we find that the thyroid is low and you have a sight hound, that could be their normal. We don't want to start supplementing with thyroid medicines if that is their normal, because we will create problems. So what do you check then? So this is where a comprehensive thyroid panel is essential. And this is something that you should be running for your dogs and your cats every single year versus just running that T4. Yes, if you're running a comprehensive panel, that T4 will be a part of it. You're not paying extra for that thyroid. So what we need to be measuring is T4, free T4, T3, free T3, and thyroid antibody. And this is where we miss it, because we want to be looking at, is that thyroid gland actually working? So, or is it like that HPA axis off, the pituitary gland is being overstimulated and that thyroid gland isn't working? Or is that feedback not actually getting to that pituitary gland to stimulate TSH, to stimulate the thyroid to produce T4? Yes, there's a whole feedback mechanism, but it can be like, for example, a toaster. If I cut off the electrical cord to the toaster, it doesn't mean that that toaster still doesn't, like, it wouldn't toast the bread if it had the cord plugged in. So it's like the thyroid gland can be perfectly fine, but another part of that pathway is off. So it doesn't mean that I should just increase iodine and throw in kelp and all sorts of things to give more like T4, T3, because we will create a problem. So that's where testing a full thyroid panel is going to give us an idea of what's going on. That thyroid antibody is so important because roughly 20 to 45% of dogs will develop the autoimmune form of the thyroid issue. And here's the thing. They could have antibodies that show up that are positive on this blood test, and their thyroid levels, everything else can be normal. And the kicker is, and this is where a lot of people will tell you not to treat because they're not showing symptoms. But you have this autoimmune storm that's brewing in the body. And it's like your pet is just like ticking along, right? It's like us, like you get like headaches or you're just a little bit tired and you're like, I'm fine. You keep doing the same things, something's going to break. It's the same thing with thyroid disease. And this can be a reason why we see so much thyroid problems in our pets. And it's really important that if we are testing for the antibodies and the antibodies are high, you need to start treatment. Yes, that means thyroxine. Yes, that means the chemical, the drug to replace that. But what it does is it helps your thyroid gland, the pet's thyroid gland, settle down. It helps the body, the autoimmune response, take a break. So it's less likely to cause more damage to put your pet into an issue where we're now seeing low T4 or low T3 circulating in the body. It's not the same dosage. Usually it's about 3/4 of the dosage of what you would use. And that's really, really important. Do not wait for a diagnosis to treat. That's the thing. That is like my whole entire business. I see people every single day that have weird, crazy diseases or symptoms. Actually, they don't have disease yet because it hasn't progressed to being able to diagnose it with a name. And I'm like, you know what? Doesn't matter. Don't need a name, because we can look at the foundations of health. Where are those imbalances? And use food as medicine. Use herbal medicine, use supplements to support the body, use diagnostic tests like this entire thyroid panel. If you are in the US, and I don't know where you can go outside the US, so I apologize for our overseas listeners, but Michigan State University, HemoPet will do these full thyroid panels where they are testing T4, T3, free T4, and your TGAA, your thyroid gland autoantibody. And yes, your vet, your conventional medicine vet, should be willing to run these other thyroid markers. And if they say no, tell them to draw some blood, run it down. You'll fill out the paperwork for HemoPet, and you can send that, you can have them send that blood work to Dr. Jean Dodds at HemoPet, and she will get back to you. So there are ways around that. And if your conventional vet refuses to run a test to actually see if your pet has is truly hypothyroid or hyperthyroid, you need a new vet. That's just hands down. They're not looking at the best thing for your pet. So that's really, really important. For your cats, this is what's really, so Dogs briefly, when we're testing, a lot of times, and you'll see this with internal medicine doctors, and I highly recommend Dr. Jean Dodds, go to Hemopet and start looking at all the research she's done for over like 30 years on thyroid disease. Read her book, The Canine Thyroid Epidemic, I believe it's called. If you look up Dr. Jean Dodds, Canine Thyroid, you will see her book. Read it. It is so powerful. And the thing is that a lot of times what we're looking at and what we've been taught is to look at T4 and TSH. And there is such an equivocal area, gray zone, that makes it really difficult to actually identify, does this pet truly have hypothyroidism, or are they euthyroid because there's another condition going on? The other thing is too, is that test, TSH, T4, is not going to identify those dogs that have that autoimmune storm brewing, but haven't come back with a low thyroid issue. So another thing, another reason why we want to check that. TSH pretty much doesn't do anything for the dog in terms of testing it. And so you can ignore that as a vet. If you're listening, follow Dr. Jean Dodds and check it out. You don't need to look at TSH. If you have an older cat, so this is really important. I know there's quite a few people in this community, hyperthyroid cats. I've had hyperthyroid cat growing up that had the radioactive iodine treatment. So what that does is it pretty much obliterates the thyroid gland from producing too much thyroid hormone. And those cats can actually become hypothyroid like a dog in roughly like 5 to 6 months after the treatment. This is really important for when I mentioned that kidney conditions can happen alongside thyroid issues in cats. So it's really important to make sure that we've ruled out kidney issues before you go through that radioactive iodine treatment with your cat. So that way we're not all of a sudden having full-blown kidney failure and now we have a whole new issue. But if a cat does become hypothyroid, you're going to see similar symptoms to that dog. They become like a slow moving blob and they're like, I'm so tired, and their coat becomes like unkept looking and they like just down and they're gaining weight potentially. They just feel blah. And if you have an older cat, you could be like, oh my gosh, this is it. Like they're at the end of their life and we're done. They could actually be hypothyroid, and you can treat with supplementing with T3 and T4, but we need to actually test the TSH in cats. So cats are a little bit different. So we don't necessarily check for the autoantibodies. Yes, there's potentially some cats that there probably are cats that are getting autoantibodies against the thyroid, but there's not a lot of research out there. But we can test the TSH in cats, the thyroid stimulating hormone, to actually see, is this cat hypothyroid, or is their thyroid gland doing enough? And then we use that to monitor treatment. So then if we need to supplement low levels of T4, T3 to get that perfect balance, then we can check, okay, now are we at the right level for this cat? Are they optimized? And you're going to see improvement in how they feel and how they're moving and their energy levels too. And a lot of times you're going to see them feeling so much better than they were before they started developing the thyroid issue. So there's a lot of variance and there's a lot of information behind that, and it's confusing. But here's the thing I want you to take away is ask for that full thyroid panel. You're not just checking T4 anymore. You're not just checking T4 and TSH. You're getting a T4, free T4, T3, free T3, and the TGAA, the thyroid gland autoantibody test for your dogs, and you're adding in TSH for your cats. You're sending those to Hemopet if you're in the States, or you're sending it to Michigan State University for that full thyroid panel. If your vet says no, find a new vet or get the blood work drawn and send it to the lab yourself or have them send it. I know most vets will just draw it and it is what it is. But those would be the things I would do to ensure that your pet we are for surely ruling out those issues. So what can you do to support thyroid health? I mentioned this is there are many reasons that any issue can happen. And yes, sometimes we can't show that the diet by itself caused these issues, but we know that a lot of diets are poor. They're poor quality, they're species inappropriate, they're not biologically appropriate. You're feeding a cat a dry food diet, they're an obligate carnivore. Once again, you want to learn more about diets, about raw, fresh, kibble, join my monthly webinar. We're going to go for 2 hours and probably longer. So make sure you join that. But the thing is there's things we can do to support thyroid gland, right? There's always something we can do. For one, get them on the right food, especially cats. We're seeing that a lot of these cat foods, they have fish. The canned foods could be actually putting in hormones. So you're actually adding in things from the can lining into your cat that can be overstimulating the thyroid gland. You need to get them onto high quality raw foods or canned foods is essential for cats. We have to get them off dry food. We have to reduce the artificial preservatives. We have to reduce the chemicals, the glyphosate that's going into foods. So if you have a food that's predominantly pea protein, guess what? That crop is finished with glyphosate. It's a higher concentration of glyphosate than if you were to feed something like oats. It's insane. And there's numerous studies that have shown that our pets, when they are fed a kibble diet, have higher concentrations of glyphosate in them. It's been done. It's been shown. And when compared to a raw fed diet, those pets are significantly less. So we have to start looking at these studies and how food is being made, not only for our pets, look at it for yourself too. Processed food is crap. Like, I'm just sorry, it is. And when you put crap in your body, when you put crap in your pet's food or when your pet's body, you're going to get disease. And the downside with food is that it's a good thing because there's a lot of bad diets. And unfortunately, a lot of people don't realize them. The thing is that food takes the longest to cause a problem or to create a positive change. So it can be the best medicine for your pet long-term, or it can be the slowest form of poison. That's really important to remember. And every single disease can come down to something being changed genetically, in the blood, the proteins, inflammatory pathways, and food can change that. So food is so important, and I talk a lot about it, and it is one of those things that can be really confusing, but food is really, really important. And going back to treatment, so I'm talking more about natural remedies. Let me backstep a little bit briefly. Your conventional treatments, when your dog or your cat has been diagnosed with a thyroid condition with the right testing, you have to use treatments, and don't use generics because they don't work as well. And they're not sure why. Is it fillers? Is it colors? Is it whatever? So make sure you're using the brand names for the pets. So do not take your pets off thyroid supplements, even if our thyroids are normal and they have especially if they have the autoantibodies, because you're going to set up that autoantibody storm in the body, and it's going to wreck the thyroid gland. So keep your pets on their thyroid hormones. Make sure that you are doing those appropriate tests. Now, if you have a dog that has, like cats, like hyperthyroidism, so easy to see symptomatically, like crazy cats losing weight, you test it thyroid high, like put them on the medications, monitor kidney disease. For dogs, a lot of times if you have a dog that has chronic skin conditions and they're not getting better, a lot of times a vet will test T4 and it's low, and they go, your dog might be hypothyroid. Let's just put them on the thyroxine and see how they do. That's not appropriate, for one. So number two, what you can do to see if your dog is truly hypothyroid, if your dog's on the thyroid medicine, you can take them off of it, working with your veterinarian, and you can retest in 5 to 6 weeks, full thyroid panel, to see where that actual thyroid level is at and the autoantibodies. And then you can go, okay, they were actually euthyroid if everything's normal from the skin disease or from the breed or whatever. There's other factors that I mentioned towards the beginning. So make sure you're working with someone that truly understands the power of a full thyroid panel. If you're thinking like, I don't think my pet has thyroid disease and they were put on a thyroid medication, because there are things you can do to see if they truly need it. But if your pet has been diagnosed with the right ways, do not take them off their thyroid medicine. It is helping them. And that's really, really, really important. And so going back to, okay, number one, food, make sure they're on the most appropriate diet. For cats with hyperthyroidism, so supplementation, things with like carnitine is really important. And carnitine's often depleted in hyperthyroidism. Secondary heart conditions, the kidney conditions, remember everything is interconnected, and carnitine is huge in the heart muscle. And so supplementing this for your cats can help them because it can naturally be low. Now, if you're using things like raw food diets and you're adding that into their life, a lot of times you don't have to necessarily supplement that, but you can use 125 to 250 milligrams twice a day to help them. Another really cool thing, and I use a lot of Chinese herbs, and that's where looking at the imbalances in the body, and I mentioned I don't need a diagnosis of a disease because there's going to be imbalances before that disease progresses to a point that conventional medicine can give a name to. And that's why I love integrating in holistic medicine into the conventional perspective, because we can hopefully treat early and keep that pet from getting a disease name. Does that make sense? So what we can do is if we're worried that there could be a thyroid issue, they're not showing up, they like as low thyroid for dogs, we can use things like lemon balm or Melissa, and that's a natural remedy that can help in the early stages of disease. So Melissa, the essential oil, so I include a lot of essential oils into my treatment protocols. Melissa myrrh is another one where you can actually apply a little bit like on the top of the thyroid, and it's going to help protect the thyroid gland. So these are things you can do alongside if you are giving treatment. The other thing I tend to use a lot of is what we call organotherapy, using the organ to treat the organ, right? Now, this doesn't mean going and getting all the thyroid like glands and putting them in the food. No, don't do that. You will create issues. And this has been an issue with some of like the raw food diets, especially with like red raw meat, because in the pet food side, you get the gullet, and that has the thyroid in it. And that can be put in the food potentially that goes into the pet food side. Here's the thing though, it's not just raw food. So if you're like, I told you raw food was bad, guess what? It was in the kibble too. So it can happen with any pet food. That's the thing. So we will see those pets get into hyperthyroid where they're hyperactive, they're losing weight. We test, the thyroid is high. We can go, what happened? What changed in the environment? We can go back to the food and take a look. So that's something to be important or to be aware of that can potentially happen. Now, if you're using human grade red meat, that is not allowed on the human side. This is why the pet food industry is jacked. So there are different requirements for human grade and pet food. So keep that in mind too. The other thing with using organotherapy, so I use things like Standard Process. They have a canine thyroid support supplement, and I'll use that alongside whole body support, and we can integrate that into the biologically appropriate best food. And that's going to give whole food nutrition, and it's also going to have organ meats that are processed to be more biologically available to the body that support those systems. So we can use certain supplements to help support. Make sure your pet is not being over-vaccinated. This is really important also. And here's the other thing. If you are getting, studies have shown that if you get a rabies vaccine for your dog or your cat, do not check for thyroid autoantibodies within 45 days because those levels will be higher. And it could be in the range where it's equivocal or a low level, and you go, is my pet starting to develop an autoimmune issue? I don't know, because levels change. That's why it's so important to continue to test, especially if you're breeding. Like if you are breeding animals, you do not, this is a genetic thing. And there's specific loci that you can actually look at that carry this genetic disease. And so when we test for it, if your dog tests positive, you do not want to breed them. But this is really important. If your dog goes in and they get a rabies vaccine and then you're getting blood work done, you need to wait 45 days to make sure you're checking the thyroid test, or else you're going to be confused even more. So really, really important. So those are a couple of like the main things. Diet is key, using natural remedies, using your organotherapy to feed and support the supplement, making sure you're not over vaccinating, reducing the toxin load in the house. These are all principles. These are all the foundations of your pet's health that we have to look at, that all come together to either create optimal health or to destroy it and create diseases like thyroid disease, cancer, diabetes, Cushing's, all sorts of problems, osteoarthritis. There's lots of reasons for disease to occur. So knowing what we know, why don't we make the changes that we can, rather than just saying, oh, it's easier, I'll just continue to feed this kibble diet, or it's cheaper, because it won't be cheaper soon. If your pet develops disease, they develop issues, that cost of medical care will go a lot higher, your pet's life will be reduced, and your worry and your stress will be increased, which will affect your own health. It's really important.